can I ask somebody, what do you think of when you think of innovation? Do you think, just sort of broad spectrum, do you think creating or inventing, or do you think repurposing and restructuring? Is it just both?
Both.
So I did a talk at Free State University a couple of months ago. And all the students in their heads, when they think of innovation, they think of invention, which is not the case. Right? And invention is something that happened. There's patents all over the world. Elon Musk doesn't patent anything anymore. It doesn't matter. It is irrelevant. The use of and repurposing is what matters the most. So I want to just show you guys something. You guys know what this is, right? I don't know if anyone knows what this is. So this is a point of care ultrasound device. My company developed this. I'm not, it's not a sales pitch, but I want to show you something. I just threw it on the floor. A 65,000 piece of food. Right. That's innovation. Because it has taken a 5 million rand device, condensed it, and made it more practical, more usable, more robust. That for me is what innovation is about. And everyone sitting in this room has the tools they need to do that. So I'm not going to speak about lists of new innovations and fancy stuff that's going on. I'm going to be a bit more practical. I actually put this picture up. So if you can see it over there, who wants to innovate? And that's the reality of things. Everyone talks about it. Ideas are very cheap. Everyone's got an idea. And I really hope you guys leave here just with a little bit of a practical sense of how you can do it yourself, wherever you are. You can have that one. Wherever you guys are in the world, that you guys are actually able to generate ideas and know that there's a space that you can come to with these ideas to actually create something from these ideas. So, just an overview. So we are going to touch on value-based care. I have to, because it is fundamentally the reason behind most innovation. We are going to touch a little bit of what it is and why it's so hard, like Mohammed also mentioned earlier, and he spoke a lot about the key stuff I like to talk about. Then I'm going to briefly mention the flywheel effect, and then I'll tell you a bit about what we're doing, what your role is, and sort of the new type of healthcare professional. So fundamentally, value-based care is a model that is very focused on shifting the doctor-patient relationship from year to year. And that's kind of what we're trying to get to, the equal, sort of bringing things to an equal standpoint. And that was something that I fundamentally focused on when I was doing my internship. So we want to give high quality care in a cost-effective manner. And the business side of healthcare means cost management, efficiencies, etc. The reason healthcare costs what it costs is because of inefficiencies in the process, mapping it from the beginning to getting in front of the patient. And that's the fundamental issue we have. So the goal for us is to improve patient outcomes by minimizing waste. And I like, so the reason I like AI a lot is because, especially the language models, because it always focuses on sort of core words, etc. So innovare for me is a very key thing, right? And which is the root word for innovation. And it literally means to renew or change. So it's something that exists, you are just renewing it. We've all been taught in a certain way, things have been going in a certain direction for a long time. The only way that it can change is renewal. And that for me is the fundamental element of innovation, which I want to just touch on. So when you guys know what ChatGPT is, I'm sure most people have heard about it in the room. So ChatGPT is obviously a natural language processing model. DeepMind launched it, it's very interesting. And it speaks to what you said, what Mohammed said about AI, and it will not replace anybody. I do believe, like Mohammed also said, the doctor who uses AI will replace the doctor who's not using AI. So all I said to ChatGPT was, please give me a list of new innovations. All it told me was telemedicine, AI, the usual stuff. We all talk about it, we all know about it. And that's fine. These are good ideas, everyone speaks about it, and I'm sure if you research and look at the literature, you'll get a good understanding of it. But that's not what I want to speak about today. So I want to give you guys a view on ways in which you can innovate. And fundamentally, there's three ways. You can either sort of change way consumers, which I do, and I subscribe to saying patients are, in a way, consumers. In the same way you are delivering a service, they are consuming what you give them, and that's a shift, a mindset shift that we must make. Because at the end of the day, if I have a business, it's my responsibility to give my customer the best possible care. And I think healthcare has shifted slightly where the doctor-patient relationship, there's too much of a gap, and you need to be proactive with your end user, your customer, your consumer. The second way we can innovate is through technology, which EM Guidance is a very good example. It's one of my favorite mobile applications. That's ecosystems that I've used it when I was an intern. I used it a lot, saved my life. Because when you're an intern in emergency medicine, you don't often know what you're doing most of the time. And EM Guidance saved myself and a patient many a time. So that for me, fundamentally, technology underpins innovation. Then the third way is through business models. And this is where things get interesting for me. Healthcare itself is a business, fundamentally. And businesses consist of multiple pieces of the puzzle. And at the end of the day, we all need to make sure each stakeholder gets what they want and need from it. The patient being one, the payer being another, the doctor being the provider, and then policy. So those business models are linked directly to those four key stakeholders. And that's just what makes innovation hard, because you need buy-in from everybody. So when you sit in your practice, and it's something we try to advocate a lot with our doctors, you are not just sitting in your practice. You're not on your own. You're not an island, not in isolation. You are part of something much bigger. And that is something I just hope I can get across to you guys today. So another thing that business has taught me over the last couple of years is that you have to know your limitations. So I asked my chief technology officer to help me with this. I said to him, what can I tell these doctors about technology? Like, how can I get them to view it and understand why it's important? And this is what he sort of guided me on saying. He said, look, it is an enabler. So again, like Mohammed said, it's supposed to take away the stuff that poses barriers. It's supposed to make things more efficient, it's supposed to make your time, which is the most important at the end of the day, spend doing what you're supposed to be doing. It also enhances. And one thing South Africa lacks, and Africa in general lacks within the healthcare sector, which is about 10 years behind the financial industry, is data. We do not, and I'm going to go against a bit what Mohammed said earlier about the data collection stuff. So we do not collect real data in South Africa, unfortunately. We do not collect usable, valuable data. And that was the gap that I saw, sort of global gap I saw, and it's a gap I'm trying to fill. The third thing is that it provides access. I'll give you an example now of access when we chat about what we're doing. And that access drives patient care. Then the fourth thing is that it does allow scale, which Mohammed also showed. But the main thing I just wanted to harp on for you guys is that it builds leverage. That's the most important thing I want you to walk away with today. You as a doctor, someone that's medically trained, you have a unique expertise, a unique knowledge base. And the reason a lot of the technology in the industry is so skewed is because it's never built with doctors' input, ever. Because doctors are sitting in their practices seeing patients, which is what they're trained to do. I agree with that. But at the same time, you need to open your mind to be accessible to these industries. So that's kind of the gap I've tried to fill. Can I ask, who of you guys have ever thought that you are selling in your medical sort of, as you go through medical practices, are you selling? Do you think you are selling? Do you feel like you are selling something? Because fundamentally sales is very important, not from a monetary perspective only. Sales is the action of giving a service and getting that other person to buy into what you're doing. So I used to laugh because when I was an intern, I used to hate referring patients to surgery. So I used to make it was a sales pitch. So I had to package this patient in the best way possible so that doctor would be like, it's done, send it now. And that was the goal. Like, I used to sit in EC. To be fair, clinical medicine wasn't my strongest thing, to be very transparent. But selling was a good thing. I always got my referrals through EC. And that was a real trick I used just to get myself over the line to get things going. I'm going to just touch on this, and I'm speaking long. The flywheel. So the innovation flywheel means whatever stems from you as an individual picks up, and the next person you touch buys into what you're doing, and before you know it, everyone's doing it.
And it does start with you. You, in your capacity, you are an innovator wherever you are. Most doctors are. Or everyone's intelligent. So this is what we're building. So a little bit against Mohammed, like I said, we are building a data sort of engine, if that makes sense. So we own about 5 or 6 companies, all healthcare-related technology businesses, all started by me through my experiences in healthcare. So one of them is My Pocket Health, which is a virtual care platform. In my last 3 months, don't tell my consultant, I didn't really touch the patients. I was doing a virtual style consultation across the table, and it worked very well. Didn't miss a single thing, didn't miss a single appendix, which is great. And with that jumping test, I can't remember what it's called. But the patients were able to understand what I was asking them to do, and that validated for me that this is something that they can do. And then we've got UImage, which I showed you now, which is a point-of-care ultrasound device. We've got inner health clinics. So that's also why I chatted to Randall. We set up a business that opens up primary care facilities. So we have digital-first, doctor-led primary care facilities. And all our businesses focus on the middle to lower income community because they are overlooked. Everyone focuses, especially GPs also, on the medical aid patients, the higher income patients. We focus on state-type patients that we believe put the most pressure on state. And the adoption has been real. Patients have adopted virtual care in the lower income community. They're doing consults. We did a session with UImage. We have this thing called social impact bonds where we leverage cash from investors, and they come through and they kind of pay for healthcare to be delivered, and we measure that output as a deliverable. And we had UImage is point of care, so it connects to a tablet, you scan. We had 250 moms come through for scans one day. My wife's actually in the audience, she was one of the doctors. That was the most scans done in that area ever. And it was enabled through this device, it was enabled through the technology, but it was also enabled through the ability to fund it. So point I'm trying to make is we all fit in, there are roles to play in each. So you see we've got Vula there, I actually almost put EM guidance in here, but so the point of this slide is to show that there's a lot of integration. So I'll give you a good example of what I think, practical example of innovation. We have this app, My Pocket Health. I struggle with scripting. We struggle to make scripts. It's difficult, like he says. What I would go and ask Mohammed was, can we license your API into our app? Right? Mohammed will come back and say, yes, Chad, of course, we'll do it. we will help you out, and we'll then integrate this into our app. At the end of the day, everybody wins. Our app is a virtual care app. Their app at the moment it's got a specific focus. So because we struggle, we know that we struggle, we can acknowledge it's difficult for us, we find a solution. And that's what innovation is. I'm not going to sit and invest 10 million rand into building what they're building. It's pointless. Same way you look through whatever you're working on, find other people who can do the things that you need. You have a core skill, focus on it. My core skill is getting people to give me money. Like, I'm good at that. So I use that. And I'm good at coming up with ideas, but I know I'm not a technologist. I know I'm not product as good as Mohammed will be. So my point is our entire model has shifted to building this sort of infrastructure, right? Where we actually create APIs, we create technology that's scalable throughout. I actually please don't take a picture of this. I did not clear this slide with my board, so it's not supposed to be in here, but anyway. So like I said, our fundamental focus is to bring accessible, affordable, quality care through innovation, always underpinned by technology. We have multiple business processes in place, but our products and services are where we go and get this real information. So our doctors, we've got amazing doctors. We've got a clinical team of about 6 doctors. That's fundamental. Then some of our doctors, we use locum-based. So I do a lot of outsourcing. A lot of our stuff gets outsourced. Locum-based is coming in, etc., etc. But our doctors are like a brain trust for us. So we use as much as possible from them, real-world experience, to find real solutions. So when you see data and AI on the side there, the data and the AI comes from real data. It's our actual clinics. It's actual scans happening on our actual device with actual moms. So that's the difference, and it's very Africa specific and South Africa. I own a biotech business, which we do like vaccine development stuff. So we developed an AI platform that it was developed in Scotland, and we're doing a thing with the CSIR where we use this AI to actually collect sort of antibody data, etc., which can be used for vaccine candidates, which is not, it hasn't been done in South Africa. But we needed to find this technology overseas to make it available for Africa, which is a problem in my, but anyway, not what I'm talking about. But fundamentally, the point is we need to be at the cold face. I was in a discussion, I know I'm over, sorry. I did a talk with Forbes a month or two ago, and one of the companies that was on the talk with me on the panel, the AI business, and I asked her, I said to her, where are you getting your information? Like, where's the data coming from? And everybody, unfortunately, is so focused high up, talking data. I said to her, we are focused on actually working with the patients, with the doctors, with the other stakeholders to create the data that we require for real output. So we own an AI entity as well, an AI business. Smartest people in the world, way smarter than me. They guide the doctors as to what information you need to collect and why. So which leads just into my last point. So our doctors and the doctors we bring in, most of them are young, they're all under 30. We put them into an innovation chain. They find a gap, a hole in the chain, right? And it's our responsibility to teach them to understand technology and understand why it's important and why you need to adopt it now. And I really want you guys, I mean, you guys are a little bit older than me. I don't mean anything by it. I'm just saying, way more experience than me, obviously clinically. And I obviously look at things and I think to myself, the doctors we engage are young, they are junior, but they have an open mind, they want change, and they're willing to work. They work hard. They're willing to work hard. So that, at the same time, I need buy-in from the more experienced doctors to be like, guys, guide us clinically where to go. You know, this is also why Randall became very important to us as we went along, because Randall's way more experienced clinically than we are. So just my role, I've positioned myself within the sort of healthcare ecosystem in between clinical medicine, finance, like funding, private equity stuff, product development. So I've positioned myself there as a liaison for doctors. That's kind of what I want to be. So if anyone has concepts or ideas, we have the resources, we have the teams, we have enough infrastructure to create sort of real products that can be useful. So yeah, that's just my end. And yeah, I just want to say thank you for allowing me the time. And I do appreciate your time.